Good day, friends, and warm welcome to this topic. The topic given to me is the mind, the body, and diabetes. It reminds me of this Hindi movie, Pati, Patni, or Wo. And not one Hindi movie in singular, but in plural, because the award winning film, which was made in 1978, was given a remake just a couple of years ago, which means that this concept of Pati, Patni, and Wo is so strong that it can spawn not one but multiple films. A similar thing happens in diabetes and health as well. The mind and the body are married to each other, like Pati and Patni, like husband and wife. And have you ever thought there is no Hindi word, there is no Hindi translation for the word divorce? The word talaq comes from Urdu actually. Hindi does have a word that is, I think, vivah vivesh or something like that, but it has been created. It's not a normal part of our vocabulary, of our lexicon, which means that the mind and body are married to each other irreversibly. It's going to remain forever and ever as long as life continues. But between the mind and the body, like between the pati and the patni, sometimes the wo comes in the third person. And here it is diabetes. So let's try to categorize diabetes today. I am very confident that our chairpersons will continue this connection even after the talk is over. But for the next 15 minutes, let's look at our conversation flow. We'll first conceptualize diabetes. We'll talk about the mind as a cause, as a clinical feature, as a complication, as a comorbid condition of diabetes. We'll talk about how concomitant medication used for mind therapy might influence glucose control. We'll see how the mind is a confounding factor, how the brain is a confounding factor in choosing therapeutic targets and in choosing therapeutic strategies in diabetes. But then we'll explore if we can use the mind itself as a contrivance, as a method of cure and as of cure itself. And then we'll finally end on a happy note. We'll talk about common sense and creativity, and we'll see how to craft good health, not only for our patients, for our great country, but for ourselves as well. So let's move on. Now, the concept of diabetes. Diabetes is defined as hyperglycemia. It's defined as carbohydrate intolerance, but it is a multisystemic, multifaceted syndrome, which can have an impact right from head to toe. And if there is one example of integrative medicine, that example is diabetes. Everything is integrated together. How do the mind and the body work with each other? The mind can cause dysglycemia. Too much of stress will lead to release of counter-regulatory hormones. Example, adrenaline, noradrenaline. These come predominantly from the adrenal glands. But you also have dopamine, a sister catecholamine, which comes predominantly from the brain. So too much of dopamine in an unregulated manner can lead to stress, can lead to dysglycemia. There is also something known as diabetes distress, which is just an emotional response, a severe emotional response to having to live with diabetes. Psychiatric disorders can be associated with diabetes, and so is substance abuse. And Alzheimer's disease plus diabetes is known together as diabetes 3C now, a different type of diabetes, Alzheimer's plus diabetes, because the cause seems to be similar for both. So now suddenly we've realized that diseases of the mind can cause diabetes. They can co-occur with diabetes. They can be a comorbidity. And it's not just psychological, it's also psychiatric. It is also neurocognitive. So a wide spectrum. What kind of features occur in diabetes? So many times your patients will come and tell you, I have brain fog. I get angry all the time. Do spare time to take a history. So when you are dealing with the husband, you ask the lady, how does he behave at home? Is he polite? Is he well behaved? Does he get angry at the slightest provocation? It might be high blood pressure. It might be high glucose. It also might be low glucose. So you may be dealing with hyperglycemia or with hypoglycemia. So the mind can be a battleground for clinical features and complications of diabetes. Brain fog is something for which you will have to go out of the way to take a history. So please be sensitive to your patient's needs. Take a good history. But altered sensorium, altered behavior, this is something that you can see from afar. And it can be a complication of acute or even chronic diabetes. It's not just hyperglycemia and neuroglycopenia. It can also be hypoxia, uh, ischemia of the brain. That also can be altered sensorium. A transient ischemic attack or chronic ischemia. Sometimes concomitant medication links the mind and the body together. So antipsychotics, especially the modern ones, and some antidepressants are associated with insulin resistance, obesity, and worsening of hyperglycemia. Some of the drugs that are used by our colleagues in neurology and psychiatry are useful in neuropathy as well. So we use these drugs for management of neuropathy. And we should learn from our colleagues in psychiatry and neurology how to use the doses, how to begin low, start low, go up slow, and how to manage the possible side effects. Along with diabetes per se or ischemia per se, vitamin deficiency can impact the mind as well as the nerves as well as diabetes. So vitamin B12 deficiency, for example, this will have an impact on the mind and nerves. It will also have an impact on diabetes control. It may be worsened by some anti-diabetic drugs like metformin. So do remember, before managing or while you are managing the mind, neuropathy, and diabetes, do remember to ensure nutritional optimization. So optimize your patient's nutrition while managing other things. And when we are looking at malnutrition, earlier we used to think of protein energy malnutrition. That's right. Now we also add obesity and overweight to the list. That's also right. But we should also not forget hidden hunger, which is deficiency of vitamin and deficiency of minerals. Now, the mind can be a confounding factor for targets for glucose control and also for therapeutic strategies. If the person is not willing for aggressive treatment, if the person is unable to manage aggressive treatment, the person is unable to manage hypoglycemia, hyponatremia, it is better to have softer targets. Don't be too aggressive. Do not go overboard in trying to control glucose, because you might end up causing hypoglycemia and worsen the patient. Hypoglycemia leading to dizziness, leading to a fall, leading to a fracture. That is not the right way to treat. Do not go overboard in treating blood pressure. Normal dose of diuretic, which may be normal for a 40 or 50-year-old gentleman, may be too much for a 75-year-old lady. So a diuretic dose leading to hyponatremia, again leading to avoidable complications. Also remember hydration along with hyponatremia. So hydration stewardship is also important in the elderly. And now we are talking of the mind. So now we already understand that the mind and the brain will help us decide our strategies and our targets in diabetes care. But all is not negative. There's a lot of positivity as well. And you can use the mind to manage diabetes. It shouldn't be sequential. It should be simultaneous. As a physician, we should be able to do both together. When your patient comes to you, the first thing you will say is namaskar. And the moment you say that, you say it from inside. So let's all do that. Good evening, good day, namaskar. Once you do that, that itself is something like you're touching the patient's mind and touching the patient's heart. So do that simultaneously. Learn the art of cognitive behavioral therapy, coping skills therapy. Use these in patients who have suboptimal behavior. If your patient is not listening to you, listening to your advice, it means you've not been able to explain why the advice is necessary. So learn communication skills as well. Yoga is a method of managing both mind and body. So learn more about yoga. I myself am learning. And meditation is just one part of yoga. Yoga is a wide spectrum. Now suddenly you will say, I read entire Harrison. I crammed PJ Mehta also. And now I have to learn all these new things. How can I do that? I cannot go back and do an MD in psychiatry. We do not need to. All we need is a little bit of common sense in Odia, a little bit of vivek, and some amount of creativity. And if there is nothing else we can do as physicians, the least we can do is to ask our patients, Madam, how are you feeling? Bhai Sahab, how are you doing today? And then you listen. Listen with both ears open. This is called diabetes therapy by the ear. by the ear. Support and strengthen your patient and his or her family. And while we are supporting and strengthening them, let's look at our own mindset and our own mind style. We are also human beings. So just like we spoke of Pati, Patni and Wo, multiple movies, Pati, Patni, Wo, or mind, body, diabetes, that impacts all of us. For us, it will be mind, body, and metabolism. If we can optimize our mind style, the way we think, the way we behave, if we can optimize our mind style, the way we think, the way we speak, the way we behave, we will be able to optimize our body. And it is a, it's a bi-directional contact. It's not to be done separately, it is to be done together simultaneously. So let us focus on our own mind style as well from now. And like always said, we just need a little bit of common sense and a little bit of creativity. And if we use this, we can easily craft good health. Now, what is good health? Good health is, like the WHO says, optimal physical, mental, social well-being. Not only for the person, not only biomedical, but also psychosocial. Not only somatic, but psychosomatic. And that is what mind-body medicine means. But let's go above that and let us see what good health is. Good health doesn't mean just good health for the person in front of you in the clinic or for you yourself as a provider. Good health also means the communication between the person and provider. So let us focus on that as well. Let us learn the art of communication. And once we do that, we will have learned integrative medicine. If we have learned integrative medicine, we have learned diabetes care. So let's be mindful, let's be more, let's keep on thinking about the various ways in which the mind and the brain impacts diabetes, the various ways in which diabetes can impact our mind and brain. And it's a never-ending story. This month, I have completed 25 years in endocrinology. I think when I passed my exams, that was at nearly 25 years ago. When I passed my exams, I thought I knew everything there is to know about endocrinology. But today I'm a much humbler person. And now I think I'm still learning. There is so much more to learn. It will take more than an entire lifetime to learn. But the best way of learning is to be with each other, to be in communication with each other. And an even better way is to have wonderful chairpersons like we have today. So thank you, sirs, for being with us.